Hello, good morning, good afternoon, or good evening, depending on where you are joining us from. And thank you for joining us for this press briefing of the Africa Centers for Disease Control and Prevention. Let me start by apologizing for that 1 or 2 minutes that we missed at the beginning. That was due to some technical issues going on. But thank you very much for. My name is Wayne Musabayana. I'm Head of Communication at the African Union Commission. And as usual, we are joined by the Director of the Africa Centers for Disease Control and Prevention, Dr. John Nkengasong. And he is going to be talking to us about the situation of COVID-19 on our continent of Africa. As usual, we will start with that briefing, and then we will go into the question and answer section. The WhatsApp number, just to remind some of you who may not have it, is +251 94 550 2310. +251 94 550 2310. But you can also still come through live and also send in your questions through the question and answer platform. So with that, let me now invite Dr. John Nkengasong, the Africa CDC Director, for his briefing for today. Dr. John, good morning. You have the floor.
Thank you, Wayne. Good morning. Good morning to everybody, and welcome to our weekly briefing. As usual, I'll give you the epidemiological numbers of where we are today with respect to the COVID pandemic on the continent. As we speak, the continent has reported a cumulative number of 10.6 million cases since the start of the pandemic. Of that number, 237,000 people have unfortunately died. If we now look at the trends in terms of how many countries are going through the fourth wave and fifth wave, a total number of 46 out of the 55 member states are currently going through the fourth wave, and 8 countries are going through the fifth wave. If we look at the trends since last week, maybe I should just mention that 40 countries are now have now reported the Omicron variant. If we look at the trends since last week we met, we've recorded a total number of 228,000 new cases, and that represents about 12% decrease. 12% decrease. So it seems we've gone up the peak and we are beginning to decrease. And in terms of deaths, we recorded from last week to today, 2,300 new deaths. And that represents also a 19% average decrease in the number of deaths. If we now look at the 4 weeks period, as we usually do, and compare the period between up to yesterday, we recorded a total of about 5% average decrease, 5% average decrease over the last 4 weeks, with countries like Egypt reporting an average of 15% increase, Nigeria 43% average decrease, DRC 43% average decrease, Kenya 37% average increase, South Africa 31% average decrease, and Ethiopia 25% average decrease. In terms of new deaths, we've also recorded 18% average increase, which is expected. As you see the number of new cases, even when they begin to peak, those who were infected previously, you continue to see deaths occurring there. We hope that over the next couple of weeks, you'll begin to see a decrease in the number of these deaths. In terms of testing, a continent, we've conducted or reported a total of 94.5 million COVID tests conducted since the start of the pandemic. With regards to vaccines, a total of 580 million COVID doses have been received on the continent. And of that number, 64% total have been administered, with about 11% of the population fully vaccinated, 11%. Egypt is reporting a 24% fully vaccinated eligible population, Morocco 62%, South Africa 27%, Mozambique 29%, and Nigeria 2.5%. 37 million doses of the AVAC vaccines have now gone to 35 member states. I think when that is all, at least for this week, let me turn it back to you for the question and answer session.
All right, thank you very much, John. Colleagues, it is time for our question and answer section. Let me just give you the details for you to put through your questions. So you have the option to come through live on our platform, and also to utilize that WhatsApp number +251 94 550 2310. Perhaps let's start off, Dr. John, with a question about the Omicron. Many people are saying that this is the variant that will kill off COVID-19. How far true is that?
It's too early when to say whether this is going to be the variant that kills off the pandemic. But because it infects many people, and as such, it means so many people have developed immune response to it. It is hoped that it will create that barrier that we've been looking for. So I think, but it's too early. We don't have any evidence, scientific evidence to point to this. But there's a hypothesis in that direction for now. You can imagine that if the virus that spreads very quickly, but results to fewer deaths, will leave people in the general population with a high level of population immunity, which may help in decreasing the severity of any subsequent infection, leading to that population-based level of immunization that we are looking for. Again, we still have to wait on the science, full evidence to show that that is the case.
Thank you very much. We rely on the science always. All right, we have Sarah Jerving, who is with DEVEX, I believe. And Sarah, you have your hand up. Please go ahead with your question.
Thank you so much. WHO has raised concerns about syringe shortages this year needed to administer vaccines, COVID-19 vaccines. Are you concerned? And what is happening currently in countries regarding syringes? Thank you.
Yes, WHO is concerned. We are also concerned that as we ramp up and scale up vaccination, that will become an issue. And we are factoring that into our planning. That is the Saving Lives and Saving Livelihood initiative. As expected, there's an overall supply chain issue across the world due to the pandemic. So syringes and other requirements for vaccination would not be an exception.
All right, thank you.
Let me just add that we don't know yet of any country that has stopped their vaccination program because of lack of syringes, but we anticipate that it will become a problem going forward.
Okay, thank you so much. Let's now say hello to Mohamodzi Mahome. And Mohamodzi is with Associated Press and says two things, actually. The first one, do you think that making rapid COVID-19 tests for self-testing and home use, making this freely available in Africa, as we have seen in the United States and in the European countries, can actually help to expand testing on the continent in order to fight the spread of the virus? So that's the first question. The second one, the WHO is yet to provide guidelines on rapid testing and self-use of these. Is this an impediment for the widespread procurement and distribution of rapid tests in Africa?
I think we should do everything possible to decentralize testing and make it, push it into the community so that people can be empowered to know their status. And if they know their status, they can take action. That would be, is critical that we work in that direction. We have not issued guidelines in that direction, but we've argued before the start of this year that we were working to actually expand testing, okay? And the most, we've learned from HIV, one lesson we've learned from HIV is that self-testing is so critical that if people know their status, they tend to do the right thing, especially for COVID. And that will also be a critical component for preparing for the next variant. So let's imagine a variant that is as transmissible as Omicron, but also is as deadly as Delta. So that would mean that so many people will need to go to the hospital. But if we have the ability to empower people to test and take a treatment, assuming that treatments like Paxlovid are available, then I think that is that will become a very important solution, a public health solution in blunting any wave, that potential wave due to any emerging variant. So I think we are all for decentralization, empowering of the community to do self-testing.
All right, thank you. Hilary Orinde from Agence France Presse. Hilary says, do you expect COVID-19 to be a major point of discussion at the upcoming AU summit? It has started already, actually, at the AU summit. And what issues specifically do you hope to raise? That's one point. What will be your message to heads of state and government on topics such as expanding access to vaccines and administering more vaccines? And what opportunities does the summit provide to help member states address these challenges?
So a full report on the pandemic will be presented by President Cyril Ramaphosa, who is the COVID champion for the African Union. And he's done a remarkable job when he was chair of the African Union, guiding the pandemic at the political level. He has since continued to be a COVID champion and is leading a COVID commission. And we expect that, not really expect, he will present a comprehensive report on that with emphasis on the need for the continent to rally around and support and scale up vaccination. I think that will be highlighted, and he will be calling on his peers to do anything possible so that as a continent, we can at least focus on the vaccination component of it. I think that will be a key component that will be discussed at the meeting.
All right, thank you. It's over now to James Macharia Chege at Reuters in Johannesburg. James says, in Nigeria, authorities are saying that vaccine take-up there is on the rise. Is this something that you have noticed as the Africa CDC? That's one part. The second part is, what would you attribute this rise to? And then he wonders, maybe the earlier hesitancy was due to reports of expired vaccines and that this has waned after the vaccines were destroyed. So the second question really is, what would you attribute the rise in uptake of vaccines in Nigeria to?
So that's a very good question, James. Remember, I've always quoted these statistics that studies after studies, including those conducted by Africa CDC, the World Bank, and a recent study published maybe in November last year, all point to the fact that on average, about 80% of the population of countries that have been studied are ready to receive vaccines. There's, of course, a 20% population out there that is hesitant to vaccines, but it's not static. Okay, each time there's noise around a vaccine, like aspiration in the media, there is noise about AstraZeneca vaccines not arriving on time. It creates some kind of hesitation in the population with respect to the ability to go out and get the vaccine. So I'm not surprised to see Nigeria, the uptake of Nigeria increasing. We also expect to see that across the board as the vaccines becomes available. We have a team in Cameroon as we speak, led by Dr. Mohamed Abdullahi, that is supporting the African Nation Cup. And we've also seen a very sharp increase there. Of course, that situation is unique because it's a requirement to get into the stadium out in Cameroon. So we continue to see increases in countries, and we, as more vaccines are available and we improve our community engagement and communication, we expect to see more uptake of vaccines across many countries.
Thank you, John. We go over to Kenya and say hello to Judith Akolo, who is with the Kenya Broadcasting Corporation. And Judith says, in the past week, we have seen an increased number of deaths due to COVID-19, and yet we were told that Omicron variant is mild. Could these deaths be associated with Omicron, or is it that Delta is still dominant in Kenya?
Well, again, Omicron is not, the narrative says, is not as severe as Delta, but it doesn't mean it doesn't cause deaths. I think that is it means that it's a reduced number of deaths compared to Delta. So, and until we see the data, the genomic data in Kenya, which we don't have at this point, it is difficult to know the ratio, the proportion of the Omicron versus the Delta. So I don't know if Omicron has completely taken over the infections in Kenya, because we don't have that data set. But please, let's not, the narrative is not that Omicron doesn't cause death. It causes deaths, but it's much less than what the deaths we have seen due to the Delta variant.
Okay, we have someone writing from China Radio International, and he is Ronald Mutia. He has 3 questions or 4, but I'll give you the first 2 and come back to him later. So the first one is, what is your comment on the cooperation on advancing health between China and Africa? Then secondly, at this time when the world is forging ahead to get everyone vaccinated, what would you say has been the Chinese contribution and Chinese efforts for the China-Africa community of shared future?
I think the African Union has a policy of an open policy for broad collaboration with all the partners and all parties. I think as long as our Agenda 2063 and Africa CDC, as you know, also has a strategic plan and a vision. The African Union also has an agenda that for our what we call a herd strategy that spans from 2016 to 2030. So I think all partnerships within that framework are so much welcome. Africa CDC currently works with a whole host of partners, including China, the United States, the European Union, probably had England, et cetera, so many to name. We work with at least 50 partners. So I think in recognition that the issues that we are dealing with, including COVID, HIV, AIDS, TB, malaria, are vast across the continent. So all collaboration that leads to that shared vision, a vision that is encapsulated